Pam Muth has been a maternal child health nurse. She's been in the health and human services sector for over 30 years. She's worked in Australia, in the United States, and here, mainly in the area of developing health and human service policy and programs at both the national and the local level. Pam Muth, ladies and gentlemen.
Thanks, Kim. And Phil started the apologies, so I'll just continue. I apologize for my accent. You'll notice that I'm not Kiwi, but I think I do come with an interesting perspective, and I think that's probably why I'm here today. And actually, I spent about 25 years of my working life working for different governments in both the U.S., in Alaska specifically, and then in Australia, and then about 7 years in business. So as a consultant, and so I sort of come with two viewpoints, one being the government viewpoint and the policy viewpoint, and the other being the business end of it. So what I've tried to do is to put together some ideas and some learnings that perhaps might be helpful hints as you start to work more and more with business and collaborating across sectors. So this talk really is about my key learnings over, I guess, 32 years or so. Anyway, the first thing I think is that businesses and the public really need to have a better understanding of the issues surrounding child health and child well-being. I think when you live in an NGO environment or a service provider environment, you just assume that everybody knows what you do, and they don't. And so I think number one is that there really does need to be a better understanding universally within New Zealand around what the issues are. And then second, that there needs to be a common language that everyone agrees to and adheres to as you begin to work together. When I switched from working in government to working in business, it was amazing the acronyms I had to relearn. It was just unbelievable. Things that meant something to me medically meant something completely different from a business perspective. So we need to come together, we need to come to a common understanding, a common language, and start there. I guess the other thing that part of that common understanding is understanding the economics of child health and well-being policy. And that's really important, especially if you're trying to get business interested in the issues. And I would just point to the work that James Heckman, who's the Nobel laureate economist, did around early childhood. Most NGO service providers will know about the work that James Heckman did and how he showed the return on investment for early childhood. But that isn't well known in the business community, and it needs to be. And so economics needs to be part of this all the way through. The other thing about bringing business in is that really you raise the visibility and the understanding of children's issues through a nonpartisan and evidence-based lens. And that evidence-based lens is especially important, especially, I think, for business. And that's certainly what I've heard in the last 7 years from business partners, is that they're interested in working on issues that are important around children, but they need it to be evidence-based. And everybody talks about evidence-based, but I think it really is something to not just sort of take for granted. If you're going to work with business, you need to make sure that whatever you're proposing is based on good, solid evidence. Second thing is that partnerships need to broaden. And I think that working in government for so many years, we all had little silos. There was a health silo and the child protection silo and the housing silo. And those silos are starting to break down. But now we need to move well beyond that and start bringing in different businesses, different entities that you might not have thought about before, such as transportation. They need to be part of the equation. This needs to be cross-sectoral and involving business. And along those lines, involving business, as Phil and Jenny said, their business is interested in this, but they're not sure what their role might be. And many of the large businesses have something called corporate social responsibility, and they're very interested in this. And I guess I would challenge you to think beyond just sponsorship. Sponsorship is fine, but I gotta tell you, I mean, coming from KPMG, we probably had hundreds of people knocking on the door for sponsoring this or sponsoring that around children, around health, around well-being. Think beyond sponsorship. Corporates and businesses have staff that have skills that you can use. And they're very, very willing to do this. Most of them do have a corporate responsibility plan. You need to find out what those plans are and work with them beyond just having them hand over money. You also need to demonstrate what's in it for business, I think. And Phil didn't talk a lot about that, but let's face it, business is business. And they need to have something in it for them to participate. And so you need to think about that as you go forward. I talked a little bit already about common goals, but common goals must be agreed, and then those goals need to be measured. And one of the really outstanding examples of this was in Victoria in Australia. There's something called the Children's Cabinet, and there is a children's outcomes framework with 33 outcomes around children's health, development, well-being, learning, and safety. And so everyone has come together to agree what these 33 outcomes are, and then in order to measure the 33 outcomes, there's 144 indicators. The beauty of this is that they not only know this from a statewide perspective, but it's broken down by local government area. So each local government area has their own, what they're calling community profiles, children's community profiles, and that really galvanizes action. And also in Australia, there's something called the AEDI, which is the Australian Early Developmental Index, and that's something that's done throughout the nation, and it really targets kids in year one, but looks at strengths and weaknesses, vulnerabilities, if you will, around children's issues, and it allows communities to galvanize around those common goals, common indicators, and common outcomes. It's very, very powerful. And then good data is essential for good decision making. And there's lots of international examples of that. One of the probably primary business ones that I'm aware of is the Annie E. Casey Foundation in the US. This is actually a foundation started by a couple of brothers who started the United Parcel Service. And what the Annie E. Casey Foundation does every year is something called Kids Count. And they also have an outcomes framework and indicators that measure quality of life for kids. It's a private corporation. They send their data out to each of the states. It's always a huge splash. It's always front page stories. And I mean, I have to tell you, coming from being a bureaucrat in the state of Alaska, for the 2 weeks before the Annie E. Casey Foundation data came out, we were shaking in our boots because we knew we would be called to account. And so if you can have good data, if you can have business involved in that, it again is just very powerful. And then my last point is that actions, again, need to be evidence-based, and they need to be appropriate for the location and the population. And one of the small conversations we were having before we came out was really about how it's fine nationally to have policy that advocates for children's issues, but really the action is local. And I think that's true also with business and human services collaborating. It really is local, local, local. And if you can have good data, if you're all speaking the same language, you're looking at the same outcomes, you have good solid data on the indicators, you have a way forward. So those are my learnings over the years. Thanks.